Welcome back to The Men. Preventable health problems are the leading cause of death among us men. June marks the official start of summer and the start of Men's Health Month.
It was actually U.S. men.
I think it's us men.
Yeah, that's close enough.
It's a creative choice.
Here to show us how we can stay healthy longer than just a month is Dr. Stephen Portz. He is the Chief of Cardiology for Healthcare Partners of Nevada. Welcome in. How are you?
I'm good. Thank you. Thank you for having me back.
Well, let's talk about this because we have hard heads when it comes to checking up on our own health. What are some of the things we should be keeping in mind when we are getting checked out?
Well, getting checked out is important, and certainly our lifestyles, especially men. We have a lot of stressful jobs. I mean, everybody really does, and especially in this fast-paced country. A lot of stress, come home tired, desk job, looking at a computer all day.
Yeah.
You know, we're not getting the exercise, in a hurry to eat, eating fast food, eating, prepared food, frozen food, cans and box foods, and not eating all the healthy stuff. So there's a lot of things that really are detrimental to our health with this fast-paced life we have here.
Mm-hmm. Absolutely. What do you recommend then? Regular checkups?
Well, regular checkups are good. I mean, the most important thing, we talk about heart disease this month, and it's by far the biggest killer of men and women in this country. Takes more lives every year than all cancers combined.
Wow.
All cancers combined.
Yeah.
And in case you didn't get that, all cancers don't come close to killing as many as heart disease.
And you hear about how many people are, obviously people should rally against cancer as well.
The sad thing is that heart disease is basically almost completely preventable. You don't have to get heart disease. So the things to start with are, one, obviously, is fitness. We don't have enough exercise because of the things I just said with our busy jobs, sitting and looking at a computer, come home tired, don't do it. But you got to make that time. You just have to fit that into your life to get that fitness and the exercise. It helps with so many things. It clears the mind from the stress that you have, and helps with weight control, keeps our hearts healthier, and then next comes nutrition, and our diets are terrible. I mean, we are the wealthiest country in the world, but we eat the poorest diet in the world.
The kings usually are the fattest of the country.
And the United States, without question, is the fattest country in the world.
Yeah.
We have now an 80% rate of obesity and being overweight.
Wow.
So there has to be really some changes, and all that's leading to just epidemic of diabetes, hypertension, needing for all these medications, heart disease, stroke, and whatnot. So there's a lot of issues, just with that.
How does testosterone level really relate to cardiac health?
Well, there may be an association. Men's levels of testosterone have been falling for decades, what they naturally are. I mean, they're much lower now than what they used to be. And there seems to be an association possibly with men who have naturally occurring lower testosterone levels than others, that there may be a higher risk of heart disease and prostate cancer. You've probably seen in the news lately, there's been some studies that have come out, particularly a VA study and whatnot. And these studies somewhat have been really highly criticized for their methods and their data extraction and whatnot, but the jury's still out on whether testosterone supplement to raise those levels actually do increase your risk of heart disease or not. So the FDA is really looking into this. There must be tens and tens of thousands, if not 100,000 men on testosterone supplements now.
Right. Wow, so the jury's still out. We'll find out soon.
It'll take a while, but yeah, it's definitely got to be looked at.
How often should men be seeing their doctor? I'm sure it's more than once every 8 years, which is probably what we're running right now. Yeah.
It's probably been that long since I've been checked. No.
Well, you can check yourself out any day you want.
Yeah, I get that periodically.
Way to make it weird.
No, it's important. I mean, young and healthy, no diseases. You should get a good physical once a year. Make sure your blood pressure's okay. Have a doc that'll kick you in the seat of the pants if you're 20, 30 pounds overweight, because that weight control is so important.
You know how ridiculous it is, though? That's what some guys are afraid of hearing, is that, there's something wrong. But it's not like it's not wrong if you don't go to have somebody tell. It's still wrong. You still need to fix it.
Yeah.
Just know it sooner rather than later.
Right? It's important that we get ourselves checked. We take our cars in. We don't want something bad to break down on them. We want to get it sooner rather than later and pay a lot more for it. And with the body, it's the same way. I mean, you get one body, one life, and you got to take care of it.
Of course.
Amen. Hey, can you tell us a little bit about the total care model?
The total care model is a model we've developed through healthcare partners. It's kind of like VIP medicine, concierge medicine, but one that comes with your product, not one that you have to pay for.
Yeah.
We have a whole slew of primary care physicians that work carefully with all of our specialists and other healthcare workers to totally coordinate the care. So we all see your records, we all have access to it. If you go in the hospital, our hospitalists have immediate access to the patient's medical records, and when they go out of the hospital, the records are immediately sent back to their primary care. The follow-up is quick, the time spent with them is quick.
Everyone's on the same playbook.
Everything's available for you, so there's not ignorance, there's not repeating of tests and whatnot. I mean, everything is there for the physicians to see.
So the guys that haven't been to the doctor recently, this kind of gets the aggravation out of having to go to the doctor. It makes it so much easier.
It makes it easy.
That's a pleasure.
Very good.
Doctor, thank you so much.
All right, thank you. Thank you for having me back.
All right, take control. Learn more about managing your health and healthcare partners by visiting the website on your screen. They're also on Facebook and Twitter. Check them out.